Okay, so figure out how you're going to remember the differences between these terms. Okay, and if you need help, I can offer help. Okay, so we're looking at page 382 now, and we see that somebody's tracking quality. We're tracking quality. We're tracking poor quality. We're counting the instances of broken instruments, dirty instruments, missing instruments, the wrong instrument, the wrong quantity. This chart's pretty realistic. Missing instruments is a huge problem. So how are we going to bring these numbers down? Do you have any suggestions on how to bring down the number of missing instruments? I think one suggestion that I'm going to jump to right away is, having spent many years as a tech, I understand that sometimes missing instruments are missing because we literally do not have them in the department to put into the set. Sets lose instruments, which is just, if you understand the dynamics of this whole system, you'll understand that that's just an inevitability. However, you can focus on not losing instruments, but you can also make sure that because you are going to lose instruments, that you have plenty in backup. So, and then you can educate the techs on the process, which is, we're not going to put instrument sets up missing this instrument. There you go. Then it's not going to be such a problem for the operating room. Other things we can do is, if it is missing an instrument, we can make sure it's clearly labeled on the outside that that instrument set is missing that instrument, and that it is being ordered, it is on back order or whatever, and then it becomes a non-issue, and it's not going to be a big deal to the user, unless it's just we don't have any of that instrument in the department. Okay, a couple other quality programs, Six Sigma and Lean Six Sigma. So Six Sigma, it's not like we're all sitting in the break room talking about Six Sigma or Lean. There's a pretty good chance you'll be talking about Lean, but maybe it won't be talked about as Lean. However, okay, so Six Sigma, the objective is to deliver high performance, near perfect products and services. And how is that done? This is done through analysis. DMADB and DMAIC. Okay. DMADB is to define, measure, analyze, design, and verify. So this is about processes. Note that verify starts with a V, and then DMAIC is define, measure, analyze, improve, and control. So we're going to improve and control a process. These are components of Six Sigma. Lean, however, is about eliminating waste. What is waste? It's not really just about how many, of this item we're throwing away because it got contaminated. It's also about the amount of time being spent on working a process. And so note that Lean and Six Sigma start with the same thing. Map out the process. In the case of instrument assembly, each step the instruments take from use to reuse is documented. And then they diverge. With Lean, we're really focused on cutting waste, like wasted steps. Why do I have to stand up every 2.5 minutes and walk over there to get something that I need over here? So the work areas can be rearranged to eliminate a lot of unnecessary movement, and thus cutting down time. You're going to find ways to do Lean on your own because you're going to get sick of doing that. Okay. On page 384, we see that we have a Postit board, looks like a whiteboard full of Post-its. These are suggestions from the team members, the people who are working the processes, on things that we can do to improve the process and eliminate waste. And page 385. Other quality programs and standards, excuse me, sorry. Okay. Quality efforts of healthcare facilities are also impacted by external agencies whose requirements must be addressed. CS techs should be familiar with the following. You've probably heard of the Joint Commission by now. The Joint Commission exists to keep high standards of patient care for patients. They will do routine announced and unannounced inspections into facilities. So even though everyone gets all shaky when they hear the Joint Commission is in town, you probably don't need to do that. Just make sure that you're always doing right by the patient by keeping your standards high. And then when the Joint Commission comes to town, they will find some minor things, but it's not going to be like a black eye to you. When the Joint Commission comes to town, they're going to come into your department and they're going to start asking random people questions like, how do you know how to clean this? How do you know how to sterilize this? And of course, you know the answer to those two questions because I have the instructions for use, and the instructions for use for the manufacturer state X, Y, and Z. Okay. The CMS, the Centers for Medicare and Medicaid Services, also do surveys, announced and unannounced. Now, the difference between CMS and the Joint Commission is the CMS is the big player here. They're the government. They are a .gov web address. They could be coming in and doing the same thing as the Joint Commission. When the Joint Commission comes in there, the Joint Commission is going to be making sure that you are using instructions for use, that you understand the processes. They're going to make sure that you, I just lost my train of thought. Oh, that you're abiding by standards that are established by organizations like AAMI, AORN, etc. And even the Joint Commission has standards. CMS is going to make sure that you're obeying the laws, that you're doing right by the patient by abiding by standards. So the Joint Commission can come in and if you're not able to actually improve what they tell you to improve within a certain time frame, then you could stand to lose your ability to get funding back from the government, from CMS, which means that you cannot, your hospital cannot be paid for services rendered because we can't just tell indigent people that or people without insurance that we're not going to help them. To have insurance like Medicare or Medicaid, obviously we can get refunded from the government for services provided. Unless, of course, the government decides that they're not going to pay us because we're providing very poor quality. Okay. Now, on page 386, the Hospital Consumer Assessment of Healthcare Providers, a System Survey and Value-Based Initiatives, also called HCAPS. So they send these surveys out to people who were patients in hospitals. And how do you think patients respond? They were in the hospital and some dude cut them open and took out parts of them, and they laid there in pain, and the nurse wouldn't give enough painkillers and etc. So hospitals don't really get rave reviews necessarily. If you go and check out like reviews like on Google or Yelp or whatever for hospitals, patients are not happy. They're not happy. Okay, magnet status. This is something that hospitals strive to get. Magnet status is an award by the American Nurses Credentialing Center to hospitals for quality patient care, nursing excellence, and innovations in professional nursing practice. So back to HCAPS. Hospitals actually do pay attention to those surveys, and if they find something that can be changed, if it seems to be a recurring issue, they will address that. Because if there are two hospitals next to each other, you want to have a, well, if you're running a hospital, you want to have a very good score on their surveys. But patients do have a choice very often where they can have their surgery done. I know a couple hospitals that I would never go to. I'm not going to share that with you, but I just have my opinions. Okay, magnet status. Think of it like this. If you're a magnet, then you're a magnet for very good, highly rated doctors and nurses. Okay. And if you have very good, highly rated doctors, they're going to bring their patients to your hospital. You're a magnet. International Standards Organization, ISO 9000. Doesn't matter if you put the space there or a hyphen there or not. International Standards Organization, ISO 9000, is something that most CS departments will not apply for this status because it just doesn't matter. We don't need to apply for ISO 9000 status to be an excellent healthcare provider department. However, many hospitals, not departments, hospitals apply for ISO 9000 status. And nobody knows what that means. I saw some work truck, I don't know if it was an air conditioning truck or something, and it said ISO 9001. And I'm like, dude, nobody knows what that means. You just wasted paint on the side of your van. Okay, we have 10 minutes left. All right, quality CS procedures. Attaining and maintaining high quality CS standards is everyone's responsibility. Keeping the patient as the focus means helping to ensure everyone is properly trained. So when that new guy comes into your department, you might be assigned to help train that new guy. So somebody needs to be doing it. Performing departmental audits of each area of the department on a regular basis. Don't wait until the Joint Commission is in town. It should be routine. We should always make sure that our standards are high. Should always follow departmental policies and procedures for processing protocols. Make sure that there is a understandable set of policies and procedures and that everyone is familiar with what those policies and procedures are. It might be a big fat book with a bunch of pages in it. However, every year we need to make sure that everyone is keeping up on that. You should keep current with new technology. You should take an active role in quality improvement processes. You should assume responsibility for survey readiness. You should adopt a team mentality and help coworkers and and accept help from them. I don't know where I got do not from. You should accept help from them. Even if you're the bomb diggity and you've been doing this for 190 years, you're part of a team, so accept help. And obtaining your CS certification and then going beyond, there's CIS, there's CHL, there's CER, no, CER. So there's many certifications that you can get and maintain. And every time you get one, it's another check mark in your column of awesomeness. Okay, in the prep and pack area, in the sterilization area, in storage and distribution areas, in all central service distribution areas, there are areas for concern regarding quality. For instance, in prep and pack, you should check for holes in all wrappers and disposable filters to ensure that they are intact before sterilization. What good is it going to do if that wrap has a hole in it before you sterilize it? It's never going to actually be sterile. So go over these bullet points and understand these. If you have any questions, please don't hesitate to get in touch with me. For instance, all central service distribution areas, the bottom bullet point says, always help other staff members. Did I really need to read that to you?